First one's called the pinch and twist. Forgive me, I'm looking at my notes because a lot to remember. And it comes from the acne world. It's a massage for acneic skin. The fancy name is the Dr. Jacquard technique, or I call it the pinch and twist. And the twist is because the pores are not directly up, they're all lie at different angles, hence the twist. And it's decongesting, it's good for all skin types. If you've got rosacea, do be a little bit careful. If you've got particularly across your cheeks, maybe do it everywhere else and not on your cheeks. And if you're an acne lady, do be careful of cystic acne. You don't want to do this over your cystic areas. So it's pinch and twist, and it's literally the pressure again when you do the twist is up, and you can do that all over your face or just where you're particularly congested. Pinch and twist, and that's it. And it stimulates the dermis, which stimulating the dermis means it stimulates the collagen and the elastin, and it's very stimulating. It really makes the skin feel very alive. So that's the pinch and twist. So now I'm going to move on to the wrinkle contour massage. Wrinkles are caused by our everyday living, muscle contractions, stress, tiredness, dehydration, medications. So it's good to have something in our arsenal to diminish or attenuate these wrinkles. So this massage works on specific wrinkles, but it also helps relax the muscles in the face. So you can't do any of the massages with long nails. That's why estheticians have short nails. So here we go. It's quite a firm pressure, and you'll find that if you put using your index finger for the pressure and put your middle finger on top to push, that gives you a support, more pressure, and you can use your thumbs and other fingers to support your hand so you don't poke yourself in the eye or some such. So here we go, ladies. So we start with the forehead. Put a V action, just your fingers on one hand, and then with your dominant hand, your index finger with your other finger on top to give you support. You do deep circles across, back and forth 3 times on each wrinkle area. Back and forth 3 times, good pressure. I actually find I do this mainly in bed at night when I go to bed, because you can actually use a lot of pressure. So I find it's supporting my head so my head isn't moving away, and also it supports your shoulders. So that's where I recommend doing it. So with the V, fingers on top of each other to give support, and pressure 3 times, back and forth 3 times on each wrinkle. Do the whole of the forehead, and then with the same V and the single finger now, you do a wave action across each one 3 times, and then move to the next, back and forth 3 times, and you do that across the whole of the forehead. Your index fingers just above your brows, and then with your thumbs you stretch those muscles. We've got these 2 muscles that come up here, 2 flat sheets of muscles, so you stretch them in various places, and again do that 3 times. And then we do the corrugator muscle, which gives us this line here. This is where they contract. So you get thumbs under the brows, fingers on the top, pinch it, lift and pull to the side. Up, grab it with the index fingers, pinch and pull to the side. So it's an upwards, outwards, stretch to the side. Upwards, outwards, stretch to the side, and do that 3 times. And then you do across the whole of the brow. You'll notice that some of these moves are similar to the lymphatic drainage and the digitopressure, because it's a mixture of wrinkle contour and also relaxing the muscles, which obviously then lead to wrinkles, so you want the muscles relaxed. So you just drain, thumbs under there, and you roll. Don't really pinch, it's a rolling action. And you can do a bit of drainage if you like. Then under the eyes, holding your pressure for 3 times at various points all along there. Then you move in a little bit so you're more on the bone now, and you do that 3 times across there. Then for the wrinkles at the side, again this V action, you open the area up, and with the index finger, with your middle finger on top to support, lovely deep action, circular actions here, and the pressure always up, okay? Always up. You do that, then you do the other eye. Then we go down to these nasal lines that we tend to get here. So you lift the cheek with one hand, and with your index finger and the middle finger on top to give support, you do the circle muscle movement with pressure up from the chin area diagonally up to the nose. And the pressure, holding your cheek up, and the pressure's there. And you do that 3 times. Nice deep circles, pressure upwards, chin up to nose. And then for the cheeks area, you grasp each cheek, and we're trying to create a wave action, so it's pressure, release as you move up. So you grasp your cheeks, pressure, release, pressure, release, pressure, release. And again, as ever, we're going up towards the ears. And then we do the orbicularis muscle, this big muscle that's around the lips. And it's similar to the lymphatic drainage one, but this one you keep your index finger and your finger either side, and you stretch. And you do that a few times there. So lovely stretch that. And then we do a cupping action, and it's fingers next to each other, not hands over each other, and you're sliding up. But the pressure is upwards, and you just easy off as you come down, slide down. Pressure on your chin, up you go to the ear, slide down. Up you go to the ear and slide down. Up to the ear and slide down. You do that on the other side. And then we come to the neck area, and you cup your jaw, whether it's this way or that way, whichever you find comfortable, because it's a little bit awkward. So we're holding this masseter muscle and all these muscles up on the jaw here. We want to sort of just work on this muscle coming down the neck. And you're doing stretching. Stretch down to your décolleté, easy up, pressures down, easy up, pressure down. You do that both sides, 3 times minimum. Then we come to the back of the neck, and it's circle motions up the back of the neck, up to the occipital bone. Push your fingers into the occipital bone and hold. And that move is really good, holding it in the occipital bone if you've got a headache or a sinus attack. It's really effective. It's a very gentle action, beautiful release of the tension in the neck. So circles up, pressure into the occipital bone, and then just finish with some draining action. You can drain up the face if you like, and around here and up there. Et voilà. See you again. Bye bye.